ocular trauma, as we all know, is one of the emergencies that we face often. And as far as the worldwide incidence of ocular trauma is concerned, about 500,000 people in the world are blind as a result of eye injury. 30 to 40% monocular blindness is due to ocular trauma. If you see the United States registry alone, about 2.5 million eye injuries occur annually, with about 50,000 people almost permanently losing part or all of their vision. It's a multimodal peak. The first peak is around 5 to 25, and the second one is at 70 years, and men are at risk almost 4 times higher than women. Spectrum includes all types of injuries, right from ophthalmic trauma, ocular adnexal injuries, lacrimal and orbital injuries, and also cranioorbital and orbitofacial also. In systemic injuries, 13 to 16% of all ocular trauma is encountered, and 83% almost in head injuries. A short note about what is the prevalence in India is about 3.75, higher in rural areas compared to the urban, and same bimodal peak is also seen out here. Firework related ocular injuries, American Academy of Pediatrics reported that children were involved more often, and 20% of all firework related injuries are due to trauma. Chemical injuries, recent incidence has increased as per WHO statistics also from nearly 7.7 to 18, it has gone up to nearly 22%. And ocular chemical injuries, you see, are responsible for up to 45% of all occupational ocular injuries. I've just put a brief note on the rising trend, especially in conflicts that we are seeing around us, like terror attacks and wars. One is because almost 15.8% of all medical evacuations during your terror attacks are due to have eye injuries, and weapons have higher fragmentation, more explosive capacity. And just an example, in Somalia in 2019, an IED blast cost nearly ocular injuries around 24.6% of survivors. In wars, just a small this, if you look at the blast injuries, the effect, it's almost up to 90% now when you see all the wars and operations that are being carried out. In the Russia-Ukraine war, the main issue was the delay in evacuation as well as treatment. And in Kyiv, in the main military hospital, they found that ocular trauma constitutes nearly 9.4% of total wounded, and penetrating injury was around 54%, and multiple combat injuries around 81.4%. Open globe injuries, in the recent iGauge study group, it was 3.5 injuries per lakh, and 80% men and boys at 10 to 30 years maximum risk. 6:1 is a male is to female, and the prognostic factors are as given in that. And almost to note is 44.8% of visual acuity less than 6/60. Coming to closed globe injuries, Brendan Lee et al. Did a study, and they found that while scanning various registries, 4.4 per lakh, and these are some of the various complications seen, right from hyphema, vitreous hemorrhage to breaks, mainly involved young males. Sports and adnexal injuries were more common. Etiology, I have not given most of the figures because most are available. What is important is, as per the WHO, they did a study from 1990 to 2019. The increase has been mainly in motor vehicle injuries, physical assaults, sport-related injuries. Chemical injuries still hold its place, and intraocular foreign bodies have a bigger role to play. Falls in elderly constitute nearly 5% of ocular injuries. So, coming to the next part, the classification for ocular trauma. Why the need? Because it provides a simple, you want a simple, clear definition, and you want definition of various terms. Kun et al. Started in 1996, basic mechanical eye injuries into open and closed globes. Then the ocular trauma classification group by Pierre Massey and et al. 4 separate variables, which were type of injury, grade, pupil, and zone of injury. So they had closed globe, as you can see the types, the grade, the pupil involvement, and the zone, external with the internal anterior segment and the posterior segment. And as far as open globe, rupture, penetrating injuries, intraocular foreign body perforating and mixed, and the zones. Zone 1 is in the cornea, zone 2 is up to 5 millimeters, posterior limbus, and zone 3 is still posterior to it. The BET or the Birmingham High Trauma terminology is now most often followed. Standard terminology, it gave us the exact definitions for all our features of closed globe, lamellar lacerations, penetrating, perforating, and these are still followed, just a representative sample. But it did not involve periocular injuries, so the modified BET was incorporated to overcome this, where they classified extraocular injuries as with or without retained foreign bodies. The ocular trauma scope, again in the early 2000s, proposed by Kuhn et al. Variables used were the initial vision, rupture, endophthalmitis, perforating injury, RDs and RAPDs. So you have a score, raw points are there, and the raw score is the sum of all the raw points. So if you add them up, you get your raw score, and higher the raw score, better your prognosis. But pediatric OTS was not reliable with the OTS. So they added two more variables, age of onset and the location, and that was more accurate as far as the POTS was concerned. And less than 6 years, there was also a toddler score, which is called the TOTS. This was by Professor Shukla, who had tried to encompass all the various types of injuries, mode of injuries, location into one classification in 2017, which is also followed by the Ocular Trauma Society. But the ocular trauma scope per se did not address few things. Adnexal injuries, whether there is a problem with the vision at presentation, whether it is accurate predictor, whether RAPD was accurate predictor for long-term injury. So these were the factors that needed to be looked into. So the IGATES came, the International Globe and Adnexal Trauma Epidemiological Study, done by all these societies, a part of it. And main factors were to identify and influence the outcome of open globe injuries, revise and update the ocular trauma system, conduct a large multi-center review, and to develop a prognostic classification system for trauma. So it is in 3 phases. One is to get the patient information, do a study for baseline presentation variables and prognosticate factors, and further do a prospective longitudinal study. Some of the factors in the early part were done, about 10 registries are given. These were the factors that were significant in open globe, right from initial visual acuity, intraocular foreign body, and they still feel that OTS remains an effective tool in counseling patients. They have also done a few surveys, and they have found that many of the specialists have agreed on the terminologies of the Birmingham eye trauma terminology and the OTS. Thank you for your patience.